And welcome to the endocrine system. So today we're going to look a little bit closer at how hormones affect the body and work with the other systems. So the endocrine system has lots of functions and it integrates with so many systems of the body. So it's a really integral part of our function. It helps to control the volume and composition of bodily fluids. So it's constantly helping us to monitor and control those things. It controls our metabolism and energy production. It controls our development and growth. It modifies the activity of cardiac muscle, smooth muscle, and the glands of the body. So a lot of those involuntary actions that we've talked about before are controlled by hormone levels. It controls our reproductive system, which is where I think a lot of people think the endocrine system is focused, but actually it's much, much wider than that. And it also helps to control the activity of our immune system. So two key things we're going to talk about, glands and hormones. So what are the differences? So the hormones are the chemical substances themselves, and they're the substances that control the specific body functions. Glands are where these hormones are discharged from into the bloodstream. So the glands are where this feedback mechanism lies. So depending on the various levels or functions of things in the body, it determines the balance of hormones needed. So this is to prevent excess hormone secretion. So again, we come back to this homeostasis, this balance in the body, and that's what the glands help to do. So if there's low concentrations of a specific hormone, this will trigger the appropriate gland to secrete more of that hormone to restore balance. Let's take a closer look at the anatomy of the endocrine system. Let's look at the organs and the glands and the hormones that are produced by these. So try not to get overwhelmed. There's a lot of hormones and they do a lot of things, but we really want to give you an idea of how important hormones are, how varied they are, and the wide range of things that they control and impact. So let's start with the pineal gland at the very top here. And this releases melatonin. So it's only produced in darkness, it can't be produced in bright light. And melatonin receptors in the brain react to that hormone to synchronize our serotonin levels and are responsible for our body clock. So that distinguishing between night and day, when we know to sleep, that rhythm that we have is related and directly controlled by the melatonin levels. We then come down to the pituitary gland and the hypothalamus, which work very closely together. They produce such a range of hormones and control such a range of hormones. We'll start with oxytocin, the love hormone. This stimulates uterine contraction, so really important for the female body, for labour, also for breast contraction, for milk release. And it's also found in males. So it plays a role in arousal and orgasm as well. We then have ADH, or the antidiuretic hormone, and this stimulates reabsorption of water from the kidney tubules. Prolactin, this is required for the production of breast milk, so found in females predominantly, but it's also found in males, even though they don't produce breast milk, and its function is not fully understood. We have HGH, or human growth hormone. So this stimulates the growth of things like cartilage and bone. So really higher levels in teenagers, for example, in children, pregnant women, but it's in all of us. And it also helps to increase glucose levels in the blood. We then have TSH, so the thyroid stimulating hormone. And this is really where the pituitary gland and the thyroid work hand in hand. So this will stimulate the thyroid to release thyroxine. So the thyroxine levels in our body are directly related to our TSH levels coming from the pituitary gland. We then have the adrenocorticotrophin hormone, and this stimulates the adrenal cortex that we'll look at in a bit more detail to produce corticosteroids, which is probably one of the better known sets of hormones that we will come across. We then have LH, luteinizing hormone, and this brings about ovulation and that expellation of the ovum in women. We also have the FSH, follicle stimulating hormone, and this stimulates the growth of the Graafian follicles in the ovary on a 28-day cycle. So again, really important for the female reproductive system. Whereas in men, we have the interstitial cell stimulating hormone, or ICH, and this works on the seminiferous tubules in the testes, so producing the sperm in males. We also have MSH, so melanin stimulating hormone, and this is a group of peptide hormones that are produced in response to UV radiation. So this plays a key role in producing the coloured pigmentation found in the skin, the hair, and the eyes. So leaving the pituitary gland, we come down to the thyroid in the neck and the parathyroid gland. So the thyroid gland is our metabolism. So here we have thyroxine produced, T4, and triiodothyronine, the T3. And both of these are linked to the basal metabolic rate of the body. So i.e., in other words, the increased oxygen consumption by the tissues and cells in the body. So this will also affect synthesis of protein, the breakdown of carbohydrates, fats, and the release of cholesterol in the body. So really important in terms of metabolism. It also produces calcitonin, and that affects the uptake of calcium to the bone and helps our long bone growth. So it works with the parathyroid gland because it produces parathormone, which again increases the uptake of calcium. So really, really important in terms of bone health. We then come down to the chest, where we have the thymus, again found in both male and females, and it secretes T lymphocytes, and these are white blood cells associated with antibody production. So they play a vital role in the immune system of the body. We then come down to the abdomen, where we find the pancreas and the islets of Langerhans, and this is all around insulin regulation. So insulin itself, a hormone required for the conversion of glucose to glycogen. So the cellular uptake of glucose in the body and the conversion of excess glucose to fat needs insulin. So insulin, really, really important. And we already know that issues relating to this, we're talking about diabetes. We also have glucagon produced, and that is what converts the glycogen to glucose. So pancreas, really, really important in terms of glucose management. Coming down, we then have the adrenal glands, which are nestled along the kidneys there. And here we have adrenaline and noradrenaline. And they have a very similar effect, and they're responsible for our fight, fright, or flight response. And we all talk about that, going, oh my God, my adrenaline kicked in. It's that I gotta go, 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 go. So it's very much linked to that sympathetic system response we talked about in the nervous system. So it's going to affect our heart rate, our depth and rate of breathing, our metabolic rate, and the force of our muscular contraction. It delays onset of muscular fatigue, so we can run away from whatever that danger is. And it also restricts the blood supply to our bladder and intestine. So getting everything focused on survival mode. So within the adrenal cortex, we also have mineral corticoids that are produced. Those hormones regulate the salt and water balance of the body. We have the glucocorticoids, so they're going to work on the utilization of carbohydrates, fat, and proteins of the body. And we have androgens produced, so sex hormones, so testosterone, for example. So obviously a lot more testosterone found in men, but it is also found in women, but just at lower levels. Then if we look at the female system, we have the ovaries. So here we have estrogen and progesterone being produced, and these are responsible for the function of the female reproductive system and for secondary sexual characteristics. So for example, the breast growth in women. Whereas in men, we have the testes, and this is where testosterone is produced in large quantities, so responsible for the development and function of the male sex organs and their secondary sexual characteristics. So for example, facial hair growth. So how does the endocrine system integrate with other systems? I think it's probably pretty clear after going through that list of hormones that it really impacts every system of our body. So in terms of our skin, it's going to impact and affect UV light absorption and melanin production, the colour of our skin, and sebum production, so the production of oil levels in our skin. For example, overactive thyroid issues, that can lead to drying of the skin, so a lack of oil in the skin, and also our hair growth. So as we talked about, testosterone will stimulate the growth of hair. Our reproductive systems wouldn't work without these hormones. So ovulation, our 28-day cycles, all come down to hormone regulation within the body. Semen production, uterine contraction, orgasm, going into labour, all of these things are linked to our hormones. Our circulatory system, so again, we take, for example, the adrenals, that adrenaline, when that kicks in, our heart rate increasing, slowing it down when we're in the relaxation mode. So all of these hormones will have an impact on our heart and the pumping of the blood around the body. So we talked about the mineral corticoids that control sodium levels, fluid levels in the body. So that's also going to work with the urinary system. The nervous system itself, so we talked about that pituitary gland when we talked about the brain and the nervous system and where it sits. It acts as a hub of integration. So there's so many hormones coming out of that pituitary gland. So it works really, really closely with that nervous system to take information and release hormones based on the information that it's receiving. And finally, the digestive system. So again, we talked about how hormones can restrict the blood flow, can restrict peristalsis. So again, it secretes hormones itself, the digestive system, but it also reacts to hormone levels. And it can affect the motility, the secretion of digestive tract, and that movement of food through the digestive system. So looking at common pathologies that you may come across. First up is hypothyroidism. So hypo, which means too little. So where we have too little thyroxine, then we can't stimulate the metabolism enough. So what we tend to see here is weight gain, fatigue, lacking in energy, headaches, and sometimes myxedema. So this is a thickening of the skin. So with these clients, they're generally taking thyroxine, so hormone replacement, to increase their levels of thyroxine, and it has no impact to us as massage therapists. So again, typically people with hypothyroidism are on this medication for life, and once it's managed, there's nothing we need to worry about. In terms of hyperthyroidism, sometimes known as Graves' disease, which is an autoimmune disease, this is where we have an overactive thyroid, so too much thyroxine. Symptoms of this quite the opposite. So hyperactivity, lots of energy, tremor, increased heart rate, difficulty sleeping, and because the body's on all the time, we see things like hair loss, dry skin, weight loss, lack of ability to sleep, all of these negative impacts as well. Again, no impact to us for massaging, but good to understand what that client is going through. It's generally medicated and managed. But if a goiter is present, so sometimes it can have a symptom of this goiter on the neck, so swelling in the neck, then we're going to avoid that area. Then we look at diabetes. So we talked about this briefly in the nervous system. And this is where we have high blood sugar levels. With diabetes mellitus, this is where we've had high blood sugars over a prolonged period. And the symptoms of this will lead to things like needing to go to the bathroom often, thirsty, increased hunger, tiredness, and it can also lead to more complicated things. So for example, peripheral neuropathy, circulation issues, and even to coma and death if unmanaged. So we absolutely need to only work with clients who have managed diabetes. If they're not managing their diabetes, we don't want to work with them. And even if they are managed, we need to understand what impacts and symptoms they have. Do they have any peripheral neuropathies? Maybe they have and they haven't realised it yet. So we need to be modifying our pressure, especially in the limbs, as they may not be feeling at the same level as someone without diabetes. And if they do have peripheral neuropathies and we're using light pressure, we also want to look out for things like boils, cysts, cuts on their feet, sores, because they may not realise they have these things because their circulation's poor and they don't have the same feeling in those limbs. With diabetes insipidus, this is where we have a deficiency in the pituitary hormone vasopressin, and that regulates kidney function. So we end up having diabetic symptoms, so severe thirst and severely diluted urine. Moving on, let's look at Addison Syndrome. So Addison's disease, it's sometimes known, is where the adrenal gland is damaged. So not enough cortisol and aldosterone are produced. So over time, problems will become more severe. It starts out with things like fatigue, muscle weakness, low mood, low appetite, weight loss, increased thirst, but they may start to experience further symptoms, including dizziness, fainting, cramps, exhaustion. So it tends to get worse. They may also start to develop small areas of darkening in the skin or darkened lips and gums. No impact to us for massage, so we can still work with these clients, but obviously working with their mood, meet them where they are on that day. And if they are experiencing muscle weakness, making sure that we're adjusting our pressure accordingly. With Cushing's syndrome, what we seem to find here is, it's in overly high levels of cortisol. It generally develops as a side effect of treatment with corticosteroids. And those medications are widely used to reduce inflammation and to treat autoimmune conditions, also as part of cancer treatment. And what we'll find here is clients will have weight gain, thinning of the skin, they bruise easily, they'll get reddy purple stretch marks on the thighs, stomach, buttocks where they're increasing the weight, fatty deposits in the face, causing it to become very round, and then also muscle and bone weakness. It can also develop where a tumour is growing on the gland that produces cortisol. So we need to understand, one, does this person have this? And two, where has it come from? It doesn't impact us in terms of we can treat these clients. But again, if they're having muscle or bone weakness, if they're having pain, we need to be adjusting our pressure. If they're bruising easily, again, might modify pressure, light pressure, and meet that client where they are. Polycystic ovarian syndrome, also known as PCOS, is related to abnormal hormone levels in the body, including high levels of insulin. High levels of insulin, in turn, causes increased male androgens in women, and that can lead to the symptoms of PCOS. And that includes things like irregular periods, difficulty getting pregnant, excessive hair growth, weight gain, thinning hair, hair loss from the head, oily skin, acne, and all of those kinds of symptoms. It's not going to stop us massaging these clients. We're absolutely going to work with them, but it's just having an understanding of what is going on with that client. So what does this mean for massage? I would say the main area we want to focus on is diabetes. So as you saw, for most of those conditions, it doesn't affect what we're going to do, and it's not going to change what we do as massage therapists. But with diabetes, there does. So we can absolutely work with these clients. It is indicated, but we need to take into account whether or not it's managed. Unmanaged diabetes, we're not interested in. And if it's managed, we need to understand the history of that condition. So how is that client suffering? How do they experience diabetes? Do they have, peripheral neuropathy? Ask them, how are the feelings in their arms and legs? Do they get any numbness? Any history of sores? Any, peripheral neuropathy? Do they inject? Where do they inject? Not to massage the injection site for at least an hour after they've had injection. Adjusting our pressure, making sure that we understand how they feel pressure, and always erring on the side of caution. Telling your client to bring a snack in case their blood sugar drops during or after a treatment. And also watch for thin skin on the peripheral body areas or skin conditions, so sores, cuts, boils, itching. Your clients may not know they're there, so if you do see something, avoid the area, but also let your client know that it's there. And finally, as always, here are the references where you can find some up-to-date information, and also where you can read more in the Massage Connection.